I discovered functional medicine after listening to a talk by Jeffrey Bland, who presented a story of health and disease that I thought was either insane or was genius, and I figured I had to know about it. And at the same time, I was getting sick with chronic fatigue from mercury poisoning, and that kind of intersection of events allowed me to dive deep into the science of understanding how the body works, how we get sick, how we get better, looking at the root causes, and helping me solve my own health crisis.
Well, for me, the idea of functional medicine is something that I thought that I was going to be learning in medical school. When I started at Washington University, I thought I was going to be learning about health and healing and how to help people in that way. And I learned that medical school had a different focus, more on disease and pathology. And I found a book on clinical nutrition by Dr. Jeffrey Bland in 1983. And I read that and I thought, well, here's someone who's thinking more along the lines of what I thought I was going to learn.
I began really as a scientist. And my scientific career was to investigate, the immunology of the GI tract and how it translated into, when it was in disarray, into inflammatory bowel disease. And what I was working on at the time was looking at the damage to tissue by oxidative stress and how to protect that with antioxidants. And Jeff was fascinated with the work I was doing and had me out to his second IFM International Symposium many years ago. And at the conference, I had, observed many, individuals, Sid Baker and Leo Galland and others. And, we all shared information during our lectures and certainly, in little gatherings. And I became much more interested in this line of work.
That's an easy one. When I was in my early 20s, I met Dr. Jeffrey Bland, and he was then an associate professor at Puget Sound. And on weekends, he would moonlight because he had little kids, and he would run seminars. And so my friends and I would go from Eugene, Oregon, up to Portland or Seattle or wherever he was doing it. And he was really my first nutrition teacher. I started out really as an herbalist, and he was the first person who explained to me that there was actually research in any of this. And so I really started following him, and every year I would go to whatever conference he was doing. So that was before there was really a functional medicine institute at all. And so I really grew up professionally in the sphere of functional medicine, and I don't really know it any other way.
The thing about a health coach is that many clinicians like myself who have tried to be able to help people with the behavior change that's necessary to be able to move them in the direction of health and well-being, is that we don't have experience with that. We don't have training in that, and we don't actually even have the time or focus to be able to do that. We're dealing with other kinds of issues. The health coach is actually the necessary catalyst for behavior change that goes on.
Having someone spend the time to ensure that the patients are really complying and understanding the program and helping them incorporate that in their lives, because as practitioners, we don't have a lot of time to do that, and patients need time and guidance in order to comply and have optimal results.
The new movement towards bringing health coaches into the interactive team is remarkable. This is the first time in medicine we've been able to allow for our clients and patients to sit down with somebody and really address their needs at a core level.
We've got a great model, what I call an operating system for healthcare, but what we really are lacking is the next step, and that is how we actually implement this successfully in patients who will have to change some of the way that they're managing their lives, because in the end, it's about how a person intercedes their genes with their environment. In other words, they have to help themselves by working collaboratively with the healthcare provider to design a program that's going to meet their individual needs, the functional medicine program. And that means things like behavior modification. That means learning how to eat and exercise and think and rest and sleep and all these kind of things that are activities of daily living, but personalized in a functional way that makes it really operative for that person. Now, our practitioners the best people to do that? Well, they certainly have a certain skill in understanding the anatomy, physiology, and the network biology. But in terms of the daily application of this in a person's life, sometimes that's not where their skill really resides. They don't have the time. They don't have that kind of maybe training to get that deep into the patient management. So we need a coach to really kind of identify and link with that person to help them implement their own functional medicine program. And here is an unmet need that is now being filled.